First of all, hello everyone. Welcome to this talk on how to get into ophthalmology specialist training in the UK. Today, I'll be walking you through each step of the application process and hopefully how to truly excel and stand out in your ophthalmology ST1 application. We've pitched this talk at those of you who are simply aiming to secure an offer, but also throughout, I'll be sharing my insights and tips for those of you who are really aiming for those high ranks and want to secure your dream job. Throughout the talk, I'll give you my strategies, my insights, my personal real world experience to hopefully, yeah, get you on the other side. So just a little bit about me to begin with. My name's Rishi. I'm now ST2 in ophthalmology, working in North London. I was fortunate enough to rank first in the 2024 application process, matching to Moorfields Eye Hospital. Of course, that took, an appropriate amount of organization, dedication, of course, a little bit of good fortune as well. But I'm hoping that gives me, the right experience and puts me in the best position to give you the best advice for you guys to do the same. More so now, I've had a year working with iAcademy in their applications team, helping a lot of applicants through the process, able to secure offers, and yeah, it's really amazing seeing people on the other side now. And then just a little bit about us at iAcademy. We're a platform, I say a new platform, but now we've been going for about 18 months. So we have a good amount of experience and insight. We provide resources for all areas of ophthalmology, not just the ST1 application process. What I would recommend is if you follow the QR code, it will take you through to our WhatsApp community. We have a bunch of different forums there that will help to keep you updated with all our future events. And most importantly for you guys, that's where we share our limited time offers. So you want to make sure that you use those discount codes when they come up. Um, our website is i.academy. That will take you to all of our events, all of our resources. You can go through all those in your own time. And I'll touch upon the relevant things we have to offer to the application process itself at the corresponding parts of the talk. Okay, so let's get into it. This is the first of four talks that we're hoping to deliver this year, taking you through each stage in hopefully a very good amount of detail to really prepare yourself. The aim of today's talk is to get a good, thorough understanding of the process itself, what to expect at every stage, how to prepare yourself. I'll give you tips about what I did, what I aim to score. Um, and yeah, hopefully then that will help you navigate things, have a mind map, prepare yourself, and maximize your score. There's a famous Sun Tzu quote that I really like, I refer back to. It talks about knowing the enemy and then knowing yourself before approaching any challenge. Now, fortunately, you're not going to war by any means, and I don't want you to feel that way with this application process. But it is certainly a significant challenge that people get intimidated by. I won't underestimate that. Um, but the aim of this talk today is to deconstruct that enemy, so to speak, step by step. And hopefully, yourself well enough now to appreciate your own strengths and understand areas that may require a bit more work, and focus for yourself personally. Looking ahead, make sure to pencil in the dates that are shown on screen. The next talk will be the portfolio talk in 2 weeks' time. That's the one where we'll go very in depth in the portfolio. Literally, I'll take you step by step, line by line through it, and we'll talk about strategies to tick off as many points as you can. It'll be focused in two parts. One will be for those applying this year, how to get those last minute scores, how to almost physically prepare your portfolio for submission, as well as in part, we'll be looking at pitching it more towards our medical students who have joined us. And that's more about longer term thinking, strategies, research, etc., etc. The penultimate talk in January, that's going to be our interview focused talk. We've put it in January because I think if we do it too early, it will probably overload you. At this point in the application process for those applying this year, I don't think you need to worry too much about the interview. We'll touch upon it plenty through today's talk, just so you have an orientation of things. But I think if you were to do too much interview stuff too early, you risk probably burning yourself out and peaking too early. The final talk, Where to Train, that's one that we are planning to do this year based on popular demand from last year. And it will be after you're done with the interviews. You know, I know that feels a long way away, but at that point, then you're worrying about how you want to rank your jobs and where you're going to train and what people's experiences are. So that will be the purpose of that one. This is the rough structure for today. We're essentially going stepwise through the application process, and at each stage, I will share with you my tips and insights, what I did myself to be able to score very highly, and also what I've learned now from helping a lot of other people through the application process. I will also do a little bit at the end where I'll share the stats that we've collated from people who got in last year and what scores were required. That will allow you guys to work backwards and understand what points you want to aim for a certain deanery or simply to secure a post. In terms of housekeeping things, for questions, just so that we can rattle through the talk as best as possible, and hopefully I will answer the questions that you have throughout through the presentation. If you do have questions, you can write them in the chat, and we have some iAcademy team members available to answer those in the chat. And then at the end, I can answer anything that hasn't been covered. Okay, so why ophthalmology? You probably don't need that much convincing that ophthalmology is the best specialty, or at least a great specialty, given that you've given up your evening to be with us. However, I know there's a lot of medical students that have joined us who are probably umming and ahhing, not too sure what is ophthalmology. There are also probably a lot of foundation doctors who haven't had much exposure and want to learn more, a little bit on the fence. So this is my short 30-second pitch about what attracted me to this profession and what I've really enjoyed so far in my experience. And I should stress that I'm really enjoying training so far, actually more so than any other stage of medical training. So I would really urge you strongly to consider applying if you're 50-50. So the biggest attraction is that you're saving sight, and that is something of real, true intrinsic value to everyday life, quality of life, meaningful functioning. And you definitely feel that with the patients that you interact day to day. It allows the profession to be extremely rewarding and satisfying. And you really feel like everything that you've been working hard for and training is making a difference. And I think that's ultimately why a lot of us enter into medicine as a profession. Ophthalmology is a really nice, well-balanced specialty. And that means that there's a good mixture of medicine and surgery. There's a wide range of patients, all the way from your neonates with ROP to, your elderly geriatric patients with age-related macular degeneration. And so you get to meet a huge range of people at different walks of life. As well as that, the pathology is extremely varied in the same manner. And I think it's balanced also in terms of professional and non-professional work. By that, I mean you can do things like research, teaching, of course, but as a surgical specialty, and I think there aren't too many better in terms of work-life balance. And for the longevity of our career, that becomes really, really important and definitely something I underestimated earlier on. You get to perform amazing microsurgery. For me, that's one of the best parts of the job, one of the coolest, most fun parts. They're generally shorter surgeries than you might see in other areas of the operating theatre. They're very delicate, very skilled, and incredibly satisfying. You get to use really cool equipment. Um, you get to literally fire lasers, which is as fun as it sounds. You get to use cutting edge technology. This is an OCT scan showing literally micron level thickness scans and interpretation and plotting and analysis, which is just incredible. Ophthalmology is a pioneering field in a lot of areas, particularly things like genetics, artificial intelligence, big data. Recently, there was a news article sharing a microchip that was implanted that was allowing patients to restore some of their sight again. Just incredible, to be honest. And for me, the main thing, the thing that clinched it for me, that the thing that secured my interest in ophthalmology was the fact that I felt it was the part of the hospital, however much tucked away, where you found the happiest patients. And that's generally because ophthalmology, you do get good outcomes. As a result of that, you do get um, very happy doctors as well at the same time. Okay, so I've convinced you now to submit the application process. Well, unfortunately, there's plenty of other people who are thinking of doing the same. But we're gonna deconstruct the numbers step by step, and I'll show you why you shouldn't be too worried or over intimidated by this process. So we're going to reflect on last year's numbers. In 2025, there were 2,197 people that applied for an ophthalmology position in the UK. The first step on the journey to securing an offer is the MSRA exam. The MSRA stands for Multi-Specialty Recruitment Exam, or assessment rather, and that's the first filter. The top 300 scoring applicants from the MSRA were put through to the next stage. So that's a massive filter. That's, the largest filter of the application process, where a majority of applicants will be filtered out. That next stage is the ability to submit your portfolio. But actually, last year, what they did is they asked everyone who submitted an application, so all 2,000 people, to submit their portfolios beforehand. However, only the 300 people that ranked highest in the MSRA had their portfolios scored. The portfolio has a internal cutoff of 40% or 20 out of 50. If applicants were not reaching that score, they didn't move on to the next stage. And last year, I believe around 220, I think probably a little bit less, um, met that cutoff. And the final stage is the interview. From here, there were 104 posts available, and your final score was calculated as a 50-50 ratio between portfolio and interview. So essentially, out of the 220 people that secured an interview, you kind of had a 1 in 2 chance at that point of securing a place. So this is how I want you to think about things and frame things in your mind. The MSRA is a hurdle to get over. Doesn't mean it's the easiest part or anything like it, but it doesn't contribute towards your final score. You just have to get through that exam and get through in the top 300. The portfolio, in my opinion, is what dictates and decides if you'll get a job offer or not. The interview is what will determine where you train and hopefully if and when you secure your dream job out of all of those available. The reason for that, the reason I want you to think about it this way is because the portfolio is the thing that is most in your hand in terms of it's something you can prepare for, you can bank points, you can be pretty certain that you're going into the application process with X number of points. On the other hand, the interview is a little bit more subjective. It can be a little bit about what happens on the day and how you perform. It probably has the most variation in scores, and therefore that ends up dictating where people rank, where they secure their jobs. However, I would stress this is just my personal opinion and what I've seen about people who have got in and done well. This is kind of how they framed things, but it's absolutely not the rule. If you're one of those people who's deciding late on ophthalmology, you can get through with a decent portfolio, even a portfolio that just meets the cutoff, and still secure a good offer. It just means there's more pressure on your interview. Okay, so if we put those numbers together, that is a competition ratio of 21 to 1, which is scary. I would be scared if I read that. I think when I was preparing, it was like 14 to 1, 15 to 1, and I found that intimidating. But I don't want you to feel that way. And now, having gone through the process, having helped people, we are going to go through exactly why you don't have to be too scared about the numbers. And this is just another chart to scare you even more about how competition ratios are just rising exponentially. But there are a few reasons for that. Ophthalmology, it's always been competitive, always been sought after. It's more so now as more people are considering things like work-life balance, as more and more people are getting exposure to it. I think there's just a massive pool of applicants now with a fixed number of posts. The reason for that is a lot of people are returning from F3, F4 years, which are kind of drying up, fewer locum jobs available, people coming back from areas like Australia. The posts available actually last year, there were 104 posts, as we saw. So there's a slow increase, but obviously not proportionate. The other thing is that a lot of people are just throwing in applications across all different specialties. The reason for that is people are scared about maybe not getting into a training position. Also, the main barrier of hurdle that people see in their minds, the first step is the MSRA, which is multi-specialty recruitment, meaning it's used across different specialties ranging from psychiatry, GP, core surgical training, radiology. And so if people are applying for one of those, they may feel, okay, I may as well just throw in an ophthalmology application as well. And so if you are quite motivated, focused, you have been preparing your portfolio and things for a while, then actually you'll already be ahead of 75% of other people who put in an application. So that's why, and I'm sure that will be a lot of you here because you're already clued in, seeking resources, attending talks. So that's why I don't want you to be too intimidated. The other reason why I don't think you should be too stressed about numbers and you can be a bit more confident that things will be fairer is that they've introduced some changes this year, which personally I really like and agree with. So as we said previously, to be shortlisted for portfolio, it was all done via MSRA. That was the hurdle you had to get over. However, now when you do your application, you will be asked to submit a self-assessment of your portfolio. If you're scoring less than 19 in your self-assessment, you will be removed from the application process in spite of your MSRA score, even if you rank first in the MSRA. That will hopefully be a deterrent for people who are just throwing in a last minute application who are not too serious, who end up doing well in the MSRA and dropping off later, allowing spaces for yourself. The other thing is now the shortlisting process is going to be a mixture of your MSRA score and your portfolio self-assessment score in a 50-50 manner. That means that you can have a little bit of an off day on MSRA and make up for it in your portfolio, which again, it favors people who have genuinely been preparing and interested in ophthalmology for a while. So the top 350 people out of the MSRA plus portfolio will have their portfolios officially scored. And then how about shortlisting for interviews then? Okay. So out of those top 350 people that we said have met the MSRA cutoff and the portfolio cutoff, the top 260 people of those will be invited for the interview. And just so people aren't confused, if we take a step back here, obviously you do the self-assessment, and if you're in that top 350, then it's officially scored by an examiner who will change your portfolio score dependent on if they agree with your self-assessment, if they feel that you've undermarked or overmarked yourself to give you an official portfolio score. Yes, and then the top 260, including your official portfolio score, will be invited to interview. And then the final ranking is the same as it was previously. It's a 50-50 combination of your portfolio and interview. So what can we learn from that? What can we take away? Number one is the portfolio is going to be more important this year in terms of shortlisting as well, can compensate for a weaker MSRA. I think that's a good change and a fair change. It also probably means that more people are going to be interviewed this year. I imagine they should fill the 260 slots they have rather than it being filtered down to 200 or 220 last year. I also believe they're going to have a reserve list to try their best to fill those slots as well, which again is a good change, but it means that the ratio of job offers to interviews is going to be higher than 2 to 1 as it was last year, probably be closer to 3 to 1. Okay, so those are the numbers. Now let's go through each step in a little bit more detail. So the deadline to submit your application is the 20th of November. So that is in a week's time. Make sure you don't miss that. And to be honest, just submit your application as soon as you can. So if anything does come up, you're not caught out last minute. The application is done through Oriel, which is the UK-wide portal for recruitment to postgraduate medical training. It's the same thing you will have used for applying for foundation schools as well. The application process itself is run by the Seven Deanery, who actually do a really good job of things. They have all the details to everything on their website. I would urge you, if you haven't already, to explore it, and the QR code on screen will take you there. Especially things like the portfolio requirements, that will have it in much more detail that I can explain on their website. So you've submitted your application, you'll then be invited by Oriel to book an MSRA sitting. The dates are between the 6th to the 19th of January next year. Okay, so let's go into the MSRA, starting with the logistics. So, as we said, the invitation is via Oriel. It's an online booking system, and you sit the MSRA at a Pearson View Center, similar to your driving test theory, similar to your UK CAT all the way back then. I guess nowadays you're not doing SJT as part of your FPAS applications, but that would otherwise be the other time people visit there. I should say they do have an option, I believe, to do at-home online proctoring, but yeah, you can explore that on their website. The structure now. It's split into two papers. The first paper is the professional dilemmas paper. It's very similar to any SJTs or situational judgment tests that you will have done before. Again, I know it's now not part of foundation application processes, which means you don't have the recent experience. But if you think back to your UK CAT, it's very similar scenarios to what you will have come across in the past. For example, you arrive at work and you can smell alcohol on one of your colleagues. How do you manage that situation? Or there's bullying and harassment happening at your workplace. Who do you go to discuss these matters? How do you manage conflict? The question types are twofold. The first is a ranking set of questions where they provide you with the options, you rank them from best to worst. The other are MCQs where they give you various options, up to 8 options, and you select the 3 best ones. The second part of the paper is the one that we're probably more comfortable and familiar with. This is your clinical problem solving paper. It's pitched at the level of a foundation trainee. It covers all the different aspects of um, medical school and foundation. By that I mean all your core specialties, but as well as that, things like obstetrics, gynecology, dermatology, psychiatry, ophthalmology. And that's to reflect the fact that it's an MSRA, a multi-specialty assessment. So unfortunately, you can't forget about all your general medicine just yet. The question types are again what we're familiar with, single best answers. They also have extended matching questions, which are not too dissimilar. It's a run of 4 or 5 different questions that have are on the same topic and have similar answers. For example, you might have a run of questions on antibiotic prescribing, or if you're really unlucky, something like different glomerulonephritis, but fingers crossed, not for you. The 2 papers are scored equally, and each section is weighted 50-50. They then wait for everyone to do their exam, collate the scores on a normal distribution curve, with the mean score always 250 and a standard deviation of 40 on either side. So these are the numbers to aim for, and we're just going to take a step forward before we take a step back. So the number I want you to have in your mind is 523. This was the MSRA cutoff for last year. Okay, so 523. And now if we work back, that basically means you need to come in the top 15% in the exam. Obviously, you could do better on one side versus the other to make up for things, but generally that's where you would have had to be last year. Now, what will it be this year? It's anyone's guess. You would hope, you would think that because now the portfolio is going to have a bearing within the scoring system, that it should come down. In truth, I think it will probably be something similar. Last year, I had predicted that it would slightly go up, but in fact, the MSRA cutoff came down. The year I applied, it was 540, whereas last year it was 523. Again, that's kind of counterintuitive because we've seen the application numbers rising exponentially. But actually, if we look at the real world data, the MSRA cutoff coming down probably is a pointer to the fact that a lot of the application numbers are artificially increased for all the reasons we touched upon earlier. And again, it's another reason to be confident and not too concerned. Um, Obviously, still to take it seriously and spend the appropriate amount of time, but not to be overly intimidated. So these are my tips for the MSRA. Number one, make sure you get your booking in early. I always stress this. I booked it on, I think it was released December 15th for my year of application. I booked it for the 12th of January. That was simply because that was what worked best for my rota. It was in the middle of the cycle of MSRA exams at that point. Make sure you know when you want to book it, have a few dates in your mind. There are so many people sitting the exam, and there's only a finite number of centers and times available. You don't want to be in the position where you're coming off nights having to sit this crucial exam, or there are cases where people have to end up traveling to different cities, etc., etc. You want to avoid all those stresses so you can really lock into your exam. So make sure you get your booking in nice and early. For the professional dilemmas paper, the SJT, for good or for bad, there's not much you can do for it. The reason being is that it's a lot of common sense, I would say. People read things like good medical practice, which is helpful. I certainly glossed it over. There are some themes within it that you can learn. For example, consent, capacity, those themes. However, what you'll find is that because the questions are written by different people and how to deal with a professional dilemma is quite subjective, things can end up conflicting each other or contradicting each other. And so you don't want to stress too much about that. The best thing to do is use practice papers. There is one hidden away on the official MSRA website that not a lot of people see. That's your gold standard because that's coming direct from the exam board. There, they will give you a breakdown and reasoning, and you can work backwards and come up with your own rules about what to do in different situations. Obviously, you guys haven't sat the SJT, so you wouldn't have had that recent experience. But again, I'm sure there are some papers flying around the internet of previous SJT exams that were required for foundation. What I did is I created my own rule sheet using all those methods that we just talked about. And if you are struggling, you can always message me and I can try and share that with you. The aim is not to score 100% because if you get too caught up in the nitty-gritty, you'll just confuse yourself. Just learn the themes, learn the common practices. For example, if you were to ask you had a if you had a clinical issue, who would you escalate it to? The first port of call would be your clinical supervisor, then your educational supervisor. You're not going to go straight to the GMC, for example. That's a straightforward example of a rule sheet to follow. Then when it comes to clinical problem solving, again, I'm not going to tell you how to learn medicine because you've made it this far. However, for me and for a lot of people, the best thing is just to hammer home questions. I used PassMed and MCQ Bank. I know a lot of people also used them and did well and passed. There are definitely other resources out there, so see what works for you. I think I ended up doing definitely them all once through, and I think I was maybe halfway through doing my PassMed corrections. Um, but yeah, see what works for you. I then made flashcards from all my mistakes and tried to learn them. I also used it then as a source of understanding the bits that I'd forgotten from medical school, slash maybe hadn't learned too well in medical school and was hoping not to need again. But alas, you can never not cover it. And then the other tip I would give is make sure you're focusing on the high yield stuff. Fortunately, as I said, the MSRA is a hurdle you need to get over. It's not something that you need to obsess about every mark. And less so even this year because your portfolio can make up for it. If you make sure you're focusing on high yield topics, that will probably be the best way of making sure you're in that cohort that's able to go through to the next round without then spending too long on smaller niche topics that end up not being covered in your personal sitting. The caveat to that is obviously if you find exams difficult and you do feel every mark will matter to reach the cutoff, then absolutely that's a fair mindset to have. So we've covered MSRA, let's move on. The next stage is your portfolio or evidence folder. You have up until the 2nd of February to submit that, and then it's a couple of weeks after that you'll get your score. It's worth saying that you will get marks up until that deadline of the 2nd of February. So, for example, if a publication were to come through on the 1st of February, that would still count towards your evidence folder, so long as it's included. So today we're just going to do an overview of the portfolio. And as I said, we've got the talk in a couple of weeks where we're going to go into minute, extreme details about how to maximize things. But this is the overview. The first section is the previous posts that you have done. It's not a scored section. It just provides context for the examiner. You then have additional qualifications. These are essentially your extra degrees. For example, masters, previous degrees to medicine, PhDs, MDs. Unfortunately, intercalated degrees don't count. Um, that was something they brought in when I applied and felt really annoying, but everyone's in the same boat. And that's something you can keep in mind for all things that you feel hard done by, is that there are plenty of other people in the same position. Then prizes and awards. And sorry, I'll say that for additional qualifications, A lot of people, including myself, score zero for this, and I wouldn't worry too much about that. Yes, now moving on to prizes and awards. It's another very difficult section. It has a maximum of 5 points. You can get them in various ways. Most people will secure them through attaining prizes throughout medical school. And again, on the 7 Deanery website, you can see exactly what qualifies. If you're a medical student, be sure to sit the Duke Elder exam. That has very accessible points that, yeah, if you can bank them early on, i.e., during medical school, it makes life a lot easier later on. The other things you can do when you're a foundation doctor are things like essay competitions. It doesn't have to be in ophthalmology. That's what I did, um, and I managed to secure a point for that. Or you can aim to win research meeting prizes and awards as well. The multi-source feedback is something you'll have to do when you're a foundation doctor, as part of the TAB, Team Assessment of Behaviors. It's scored now 2 points, 3 points previously. You then get a section for quality improvement slash audit that is up to 5 points. For doing a good audit, by that I mean a multi-cycle audit where you've made an intervention, you can demonstrate a change or improvement in a service. That will generally score you 4 points, provided you're leading on that. To secure 5 points, it would have to be an audit or QI that's published in a peer-reviewed journal or something that has been implemented on a super-regional scale. The next section is your presentations. You get up to 6 points for that. You get different points depending on the meeting it's presented in. For example, international versus national versus regional. Also, if it's an oral presentation versus poster presentation, and if you're the presenting author or second author, etc., etc. You then have your publications, up to 5 points for that. This is the section where you get 3 points for being first author, and you get 1 point for anywhere between second and fourth. And again, there's various stipulations on the website about how to secure those points. And just reading that, I'm trying to remember if it's actually 5 or 6 points, but yeah, you can always have a look. Education and teaching, you have up to 6 points. I think those are actually the other way around. So publications is 6 points, and education and teaching is 5 points. That's for things like doing any teaching courses, providing teaching to medical students or foundation doctors, for doing a Teach the Teachers course, for creating an e-learning tool. Again, I won't go through everything step by step. That's for the next talk. The biggest section, the one that you should definitely try and maximize, is ophthalmology specialty links. This is your commitment to specialty. And a lot of the points here are very, very accessible. There are some harder points, things like sitting the FRC Opt exam. It's not essential to get 13 through that. It does make your life easier. Personally, I didn't do the FRC Opt part one before entering training, and that was because I felt like I could maximize that section without it, and I was able to do that. So again, it's just about strategizing, knowing your strengths, and working backwards. You then get a final score for up to 3 points. So that's nearly the same as, for example, a PhD for how you lay out your portfolio. And everyone assumes that they will get the 3 points for portfolio layout. And actually, I think the average is something like 1 or 2 points, which is such a shame because you work so hard on everything else that you really should be trying to score and getting 3 points. That's because you'll be surprised. There's so much stuff that ends up being in your portfolio by the end, especially if you want to be competitive, that is very difficult to lay everything out. So it's worthwhile spending the time to maximize those 3 points. Okay, so what to aim for? This is what I had in my mind. It's what I advised people last year, that if you want the best chance of securing an offer, you probably want at least 32 points. If you want a competitive location, then you probably need 38 or above. Now, having spoken to people just recently to get their opinions on things, they felt that this might even be a little bit conservative, and that probably, especially for a competitive location, you want to be maybe aiming closer to 40 and above. I think these are still good lower boundaries to have, and obviously anything more than that is an absolute bonus. So, what are the changes for this year? And what you'll find is that each year there are iterative changes. Unfortunately, the changes are never to make things easier, usually to make things more difficult and to therefore increase the range of scores of people. There were a few that I wanted to highlight. So, for example, they're no longer rounding each section. Previously, if you were scoring 3.5, you would get rounded up to 4. And so my advice to people was I would say that you don't need to aim for 4, you need to aim for 3.5. Whereas now you absolutely need to maximize the number because they're not going to round up, as far as I'm aware. The MSF, sorry, has gone from 3 points to 2 points. It's a lot more fairer now. I think most people are going to score 2 points in the MSF because you essentially just need positive comments and no negative comments. That means that other parts of the portfolio and the application process will hold more weighting. Commitment to specialty has gone up from 12 to 13. Again, I think that's a fair change. It, I think it's an area that is very accessible. The trick here, the thing that will help you secure 13 is by considering discretionary points. So on the 17ary website, you'll see the very clear markings and points prescribed for things like electives, taster weeks, surgical simulation. That's all straightforward. But then at the bottom, they also mention that you can get discretionary points. And so things that I put in that discretionary section that I was scored on was, for example, I spent a year and a half in a research group preparing a publication for various reasons that were outside of my control. That publication didn't come through until after I got into training. And so I didn't have anything at the time of application. My supervisor kindly wrote a very nice letter for me that outlined exactly what I did, how I showed my commitment throughout those 18 months and why things hadn't translated yet. And I believe I was scored for that. So there are lots of different ways of scoring in that section. Other things people do are extra courses, or they had a position in the medical school ophthalmology committee. And if you show that, it's obviously discretionary, dependent on the marker on the day, but it gives you every chance of maximizing. There's now a new emphasis on not scoring duplicate experiences. For example, in the teaching section, if you've done 5 different teaching courses, that's amazing, but they're not going to score you 5 separate points to allow you to maximize that section. It just means that you need to be smart about what you're doing, make sure that you're hitting all the different sections. And they do have certain stipulations about how you can score duplicate points. Again, we'll touch upon that next in the next talk, but it's something to bear in mind. Evidence cannot be used in multiple sections. This is something they've been slowly bringing in, but has become even more explicit. For example, if you had a piece of research that you'd presented in a conference and then became published, you have to decide which section you want to put it in. You can't put it in both the presentations and publication section. Similarly, if you're attending conferences to show your commitment to the specialty, you can't then have presented in that same conference and put it in both sections, the presentation and commitment. Go through the evidence folder in more detail to see where else that might be relevant. We're going to outline it again in the next talk. So, what are my tips for the portfolio? Number one, aim high. It's so important. Don't limit yourself. Obviously, there are some things that are not attainable or very difficult. For example, things like the extra degrees. But out of what you deem is possible, aim to reach every single one of them. Especially if you're a medical student listening in today, you've got to think about the trend of things, of how things are getting slightly iteratively more difficult year on year. the more that you can try and maximize things earlier on, the better position you will be in when those changes do occur. Organize early. This is really obvious, really self-explanatory, but the more organized you can be, the more you can have timelines in your head about, okay, this is when I plan to do my taster week. This is when I'm going to tick off that bit of research. The more the more easy the process is going to be, the more you can pick up points, the less stressful it's going to be, and the more energy you can put in to things like the MSRA in the interview. Triage and prioritize. This is this is so crucial because there's a lot, it's very overwhelming the amount of different things you need for your portfolio. But you don't have to do it all at once, all in one year. A lot of it can be staged over the course of months and years if you're a bit earlier on in the application cycles. What I did, so I decided to do ophthalmology in my fifth year of med school, and I had someone that went through the portfolio with me, like I will in the next talk. And after that, I literally printed off their sheet and I put in like kind of green, red, amber of what I think will be difficult slash easy to get versus what I can leave for later on in F2, things like a taster week, shadowing. That stuff doesn't require too much mental effort. It's just something that you need to tick off, book in early, get done, tick, get the letter. So those things you can leave for later. Things like research, etc., you need to do as early as you can. You can score points up until the submission date. As I said, you can score points up until the 2nd of February. And there are people I know, even friends in North London, who absolutely smashed the application process, who only decided to do ophthalmology very late. But in those last 12 months, they secured so many points. Things like the taster weeks, as I was mentioning. And so if you are one of those who's decided a bit later on, don't be deterred. Plenty of points up for grabs. Write your own letters. So what I mean by this is if you have done something that you want to put in your evidence folder and you need a consultant letter for, rather than just leaving it to your consultant to write what they want, write something that is honest and reflects what you have done, but also write letters so that it's easy for the person marking to give you the points. And by that, I mean, make sure you outline the stipulations that are put into the evidence folder so that you're not in a position where your marker doesn't give you points for something that should be there. Don't sleep on layout points. We've touched upon it already, but these are priceless points that just require your own effort to secure. And finally, appeal if needed. There are a number of cases where are quite dissatisfied with their original score, and then they appeal it and it goes up, honestly, by quite a lot. Even by the most I know of is like from 36 to 41. That's 5 whole points. That makes a huge difference. So don't be afraid to appeal. Fingers crossed it's not necessary, but don't be afraid to do so. So, iAcademy kindly offer a portfolio review service. Within it, you get access to a one-to-one feedback session with a current trainee that scored 42 or above in the portfolio section. You will then go through your portfolio with them step by step. We will determine an estimate of the score and an action plan to go forward. As part of it, you will also get a template of different letters that people have used to ensure that they get scores, for example, for audits, for teaching. And you will also get the iAcademy formatting guide, which is based upon what I used when I submitted my portfolio application. And fortunately, everyone who's used it last year as well, and friends who I designed it with, everyone has scored 3 points so far. So it's definitely tried and tested, and fingers crossed should be the same for yourselves. The benefits of having a portfolio review, I think it's nice to have a second marker, just have a fresh pair of eyes on your portfolio and tell you if you've missed something obvious or if they feel that perhaps you've overestimated in certain areas or even underestimated is often the case as well. It's a way of determining and coming up with a plan for how to score those last minute points. The main thing, the most useful thing, I think, is that a lot of people have evidence that they're not sure, is this going to score? Should I put it in? Etc., etc. And sitting down with someone and brainstorming and coming up with a plan of, okay, this is how I think you should word this. This is how I think, or this is the section I think it would be most useful in. This is what I think you can do to make this evidence stronger to give it the best chance of scoring. For example, in things like those discretionary points, I think that can end up being, the difference of several points in the end, which can be really important. And then, as we said, we've touched upon presentation more than enough. You can book onto the review service through our website. What I would stress is that I don't think this is a necessity for people who are going through the application process. The portfolio is something that you can have a good idea for yourself. However, people have found it very beneficial. The feedback we've received has been really, really positive. 92% would recommend it to a friend applying, and it has a rating of that's meant to reflect 4.8 stars in terms of quality of service. So it's something to consider. If you're not sure or you want to ask more questions, just reach out to me, and we can discuss in more detail. Okay, so evidence folder is all done. For the last 10 minutes or so, we'll go through the interview section. Whilst I'm doing that, I would be really grateful if you could take a moment just to fill in some feedback. That's just useful, number one, for myself for my own training portfolio, but also within the feedback form, it gives you the opportunity to write in what you want me to cover in the next talks. For example, the next portfolio talk, if you had a specific query, then I can try and answer it then. So I'll just leave that on for 5 seconds. Okay, moving on. So the interview. The structure of the interview is as follows. It's an online interview, which is a simulated patient consultation. It's scored across different domains. The majority of the marks are for your softer skills, how well you're able to hold a conversation and dictate a consultation, your bedside manner, your ability to communicate difficult ideas, and probably about a third of the scoring only is for your actual clinical acumen, your medical plan, your diagnosis, etc. Obviously, the two are going to feed into each other and both become equally important, but it reflects the fact that they don't expect you to be an ophthalmologist before you've even entered training. They want to see that you're a good doctor that can explain difficult ideas. And the purpose of training is to make you an ophthalmologist, but the softer skills, that's something that you should have hopefully been honing for the last few years. The score is out of 50, so you get 50 on each section, and then you get an average, which gets your overall score. At least that was the case last year. So there are two stations. The first station is a medical consultation focusing on clinical knowledge. You usually get 5 minutes for preparation, followed by 8 minutes uh, for your actual consultation. The topics vary greatly between usually topics that are directly or indirectly associated with ophthalmology, things like myasthenia gravis, temporal arteritis, as well as your high yield, bog standard ophthalmology conditions like a retinal detachment. The second station is focused on a difficult communication or ethical scenario. Examples of this can be breaking bad news. For example, you've been referred a patient with a suspicious lesion. Please discuss this with them, and you have to break that news to them. Or you may have an angry or upset patient. For example, you've had to cancel their operation for various reasons, and how you manage that. In terms of point scoring in the interview, I think it is a good aim, something like 35 out of 50, 70%. I think that's reasonable. I think it's definitely achievable to score very highly. A lot of people end up do scoring highly. Again, if you want those more competitive deaneries, you probably need to be aiming for closer to 40 plus, and we'll have the breakdown of the numbers in a couple of slides. In terms of preparation, this is what I did and what I recommend. The textbook I swear by, and anyone who speaks to me, I always recommend it, is Ophthalmology at a Glance. It's roughly 100 pages. It covers things in enough detail to get a bearing and a basis for things that you can then build upon. And then there are so many YouTube videos available on different lectures, on different areas of ophthalmology that you can fine tune and hone. I found it very useful to download my local hospital guidelines coming up to the interview. The reason being is you can get a feel of the genuine day-to-day practices that are done when patients are called back, the names of different medications, the regimens that are followed at in the NHS in your local hospital. I found it very useful to sit in my local eye casualty. That was mainly so that I could assimilate, osmosize all the language and discussions that were happening. And of course, the people who are marking you are the same people who are working in those eye casualties. And so if you're using the same language as them, they're more likely to give you marks. And then there are various courses available. Eye Academy has a great course on the interview, which has some lectures that cover knowledge as well. Then the other side of things is your actual interview skills alongside the clinical acumen. The key here is practice, practice, practice. And I would recommend buddying up with someone you know applying, even throughout the whole process to work with. Um, and together you go way further. People can get a bit paranoid about maybe helping other people who are also applying for a finite number of jobs. I would absolutely dispel that myth. There are plenty of posts to go around. My personal experience was that the people I practiced with all did very well, and we all secured offers. When I've entered training now, I've seen that's the case with other people as well. They've practiced with other people who have all got in. So, yeah, together you go further. In terms of resources, generally they're kind of split into two. An interview bank is, I would say, I'll never say anything is necessary, but I would highly, highly recommend an interview bank. That's what's going to allow you to do the practice with your buddy. It's what gives you an idea of the different stations and topics that can come up, and then you can practice it as much as you'd like. iAcademy have a bank that I'll discuss in a moment. The other thing is an interview course and getting practice of mock tests, getting feedback from other people, and especially current trainees who have gone through the process. Again, plenty of resources available out there, including iAcademy. So iAcademy's interview bank, as I said, you probably don't need to worry about purchasing it now, but if you are someone who worries about interviews and you think that for you, you would rather start earlier for things like interviews, I would recommend getting the interview bank as the first resource to then work through the stations slowly. Last year we had 30 plus stations. Now we're actually going to expand to 50 that cover so many different ophthalmology topics and scenarios that by the time you come to doing your actual interview, hopefully you've covered almost everything. And actually, that was what had happened for most of the stations that came up last year. Our interview bank covered most of them. It has various different modes. It has an extremely detailed mark scheme to allow you to learn the conditions and the communication side as you work through them. And it's all based upon, inspired by recent stations. Yes, so 50 plus for this year. Okay, great. You're finally at the end, and now you're through your interview and you're thinking about offers, which will come out on the 24th of March. These are the numbers that you want to keep in mind and work backwards from, depending on where you're hoping to train. So these were the number of posts available for last year. London is combined in this between North and South, but actually in your application process, they'll be slightly different. And these are the lowest ranks required for each of the training deaneries. This was the lowest score required for someone entering into those deaneries. And again, they're fairly bunched. The lowest I can see there is about 65. The highest is closer to 75 or 77. So again, you can kind of work backwards from there, work out what you are going to potentially score in your portfolio, therefore what you would require in your interview, or vice versa, and that will help you to strategize effectively. What I think is more useful than just the lowest score is the mean score, the average score of someone getting into these areas, what they scored. That's what you probably should be aiming for rather than just the lower end. And it probably reflects better the competitiveness of different deaneries. So again, the portfolio scores can be really high, um, generally somewhere between 35 to 41. Just remember, this is the average score. So there will be people who are scoring less than this, who then scored much better in the interview, and vice versa. But if you aim for something like these scores, you'll give yourself the best opportunity. And then these were the average interview scores. Again, same principles. Generally, people are scoring between 35 to 42, 43, which is extremely strong score. Feel free to take a screenshot, share with friends. Don't obsess too much about these numbers, but have them in your mind about what you want to aim for. Ultimately, the principle at the end is going to be do your best, and see where you end up. That's all you can do. So I'm just going to leave you with my 5 keys to success. Number one, organization. It's been a theme all throughout this talk. The more organized you can be, the more that you can know what to expect, what you're aiming for, how you're going to get there, the smoother the journey will be, the less stressed you'll be, the more energy you can put into the things that matter. Aim high. Aim high. It's really, really intimidating, but you can do it. Genuinely, you can do it. And it just requires all the things we've talked about, but don't put limits on yourself about you're not going to get an offer, you'll never be able to get into a certain area. You have to believe that you can to be able to achieve those things. Work together. 100% work together, guys. It's the best method in all the stages. It's the most high yield thing. And what's really good about our iAcademy forum is that you can meet other people who are working together, or working on their application and meet through that means, particularly for things like the interview. For those of you that do sign up for the interview bank, we create a group chat with everyone to peel off and practice together. And then generally people meet people they like working with and practice with them more and more. Because what you want is honest feedback rather than there are a few other resources that pair people off. And generally, people will be quite nice to each other, maybe not give the best feedback, but what you want is a group of people who are really going to push each other, and that's how you get the best results. Spend money wisely. This was my personal opinion. I didn't want to, spend a bunch of savings and a lot of money on stuff that I didn't intrinsically care about too much. Now, some people would argue otherwise, and they would say that you should buy as many points as you can. I think that's a fair strategy as well. It's not something that resonated with me. Just remember that you have different study budgets available. Even things like interview courses, interview banks can be spent in discretionary budgets within foundation. I think things like PG certs can be really expensive. I personally didn't do a PG cert, but I think if I were to do something like that, I would want to do it because I had a genuine interest in teaching. Again, see what works for you and for your strategy. Practice, practice, practice. That's more relevant, I guess, for the interview, and we'll touch upon things like that later on in the application cycle. And genuinely just believe in yourself, guys. I've met a load of you now through Taster Weeks, etc. And I think I get a sense that people are really despondent about the application numbers and the competition ratios, but you guys can do it, especially, you know, those of you who have been preparing for a little bit of time. That will in itself allow you to be ahead of a lot of people applying. And even those of you who are F2s who have just decided to do ophthalmology now, there is plenty of time to get those points. And we are here to support you throughout all of the stages. So feel free to reach out. I reached out to so many people when I was applying, and you end up getting such good advice and help, and that's what helps in the end. So yeah, I will leave it on this slide, which has the QR code to follow our community, follow into our community, and also has the upcoming dates. You can see my email there at the bottom. Feel free to ping me an email about whatever is worrying you. I should caveat by saying sometimes it does take me a while to reply. Feel free to hound me if I haven't responded after a while. You can reach out on LinkedIn. My number is somewhere on the WhatsApp group as well. So feel free to reach out. And I will just put the feedback form back up. Yeah, let's do that. All right. Thank you so much, guys. I really hope that was useful for you, and I wish you all the best in your application. We will just answer some questions now, but feel free to peel off. So when we say 20 on portfolio, is that 20% or 20 points? Yeah, good question. It's 20 points out of 50, so 40%. If we have to submit the self-assessment now, what about achievements? So the self-assessment you can submit all the way up until February, I believe. You don't have to submit it straight away. When would we have to do the self-assessment by? Apologies, I probably should have made that clearer. This is the first year of self-assessment, but on the Seven Deanery website, it says that you have up until the 2nd of February, the deadline to submit your self-assessment. And therefore, yes, I don't think it will be part of the oral application. Is the 523 ophthalmology cutoff or just the entire MSRA exam? That was purely for ophthalmology applicants. For other specialties, they have a different cutoff. Just a note, they've said all competitions should have at least 400 entrants to count. So essay prizes probably wouldn't make the cut. Yes, that is true. I think there is probably some discretionary area depending on the type of prize you win. Sometimes the competition holder may not have the information of how many entrants there are. So if you're, for example, winning a Royal College prize, I would imagine they would count that in spite of just having the number. It's probably just a deterrent for people who win a prize out of 5 applicants, for example. When they say super regionally implemented audit slash QIP, does that mean implemented in multiple hospitals slash GPs? Again, those kind of things are a little bit subjective. By super regional, I would think across different trusts myself. Again, in the portfolio review and things like that, that's where we kind of decide how to frame things and submit them for evidence. Is it confirmed they have definitely removed the rounding of points for portfolio? I don't want to definitely confirm things, but when I had a look at the portfolio scoring, I don't see it anymore where it definitely was there previously. So that's my understanding, at least. Would a master's degree in med ed points under both award points under both additional degrees and teaching? I believe not. You would have to decide which section to submit it in. Is the portfolio written as a personal statement or just evidence given in the form of certificates? So for each section, you would submit a PDF with all the evidence related to that specific section. And it's done as a group of evidence rather than a personal statement. However, in the self-scoring section now, they're going to ask you to self-score in two ways. One is a form where you will type in the score you believe that your evidence is worth for each section. And then there will be a kind of written area where you can type in how you believe you scored those points. So I guess that is in a little bit of a way, a personal statement. And then thank you so much for all your kind comments. Can we give ourselves 3 points for layout? I believe in the self-assessment section, you won't be able to self-score for layout. You'll have all the other sections, but not layout, and hence it will be out of 47. Is it too late to do research/publications? I'm in my final year. No, absolutely not. There's never too late for things. What I would say is that the best time for things like research is today, tomorrow, because research and publications take a lot of time to come through. If someone worked in ophthalmology, how can that extrapolate to a portfolio point? There is a point already within the evidence folder for having a job within ophthalmology. You said you put in evidence for an essay in prizes section. Can you please elaborate about that? Yes, so I was awarded first place in the Royal College of Ophthalmologists essay competition. So that's what I put in the prizes section. If you score between 23 to 26, of course you still have a chance of getting a post. It just means that it may not be one of the more competitive areas. It also means that you have to score particularly well in your interview. Is there a requirement to upload portfolio before deadline in February? No, it is up until the 2nd of February, and that's when you would upload the self-scoring. Perfect. I think that's all the questions. I'll stay on for a couple of minutes in case there are any more. Otherwise, again, thank you so much for attending, and please do fill in the feedback if you get a chance.